I am honored to be joined today by my colleagues in both the House and the Senate, not only as members of Congress, but also as a group of medical providers with literally hundreds of years of collective healthcare experience. We've not only researched, crafted, and voted on legislation, but we've also delivered babies, we've performed surgeries, we've provided care to families for years, and yes, we have saved lives. We know our patients and we know our constituents. So there should be no uncertainty when we say confidently that President Obama has already ended Medicare as we know it. The Democrats have done everything imaginable to hide this fact, including all this demagoguery and scare tactics to distract and misinform the American people, particularly our seniors. Let us use this time to set the record straight. $575 billion in Medicare cuts, a panel of unelected bureaucrats charged with slashing high-use areas of Medicare even further, and all the while ignoring the fact that Medicare is going bankrupt in the process. It's important that the public understand that our efforts in Congress need now be focused on saving the Medicare system that Democrats have already almost destroyed. As co-chair of the House GOP Doctors Caucus, I represent the 11th District of Georgia and practiced OBGYN for 26 years there. I am proud to be part of this group before you today because we have all decided it's time to stop playing politics and start facing the facts. As physicians, we understand that a good diagnosis is an honest one and are choosing today to put our former patients' well-being ahead of any political popularity or expedience. That's why we are here today to inform patients, families, seniors, and all Americans about the realities of the Obama administration's plan for Medicare. That is, slash the program today and slash it tomorrow. I'm proud to introduce my colleague, physician colleague on the Senate side, who's part of the Doctors Caucus in the Senate, the Honorable John Barrasso from the great state of Wyoming.
Well, thank you very much for getting us all together to talk about something that is very important. I practiced medicine in Wyoming for about 25 years, taking care of lots of patients on Medicare, and we need to save Medicare. You know, you think about this, when Medicare was started in 1965, the average lifespan in the country was about 70. Now, through the marvels of modern medicine, the lifespan in the country is closer to 80. So people are on Medicare a lot longer. And I talk to people at home every weekend. I was there last weekend. Somebody said, I paid in. And they absolutely did. They paid into Medicare. On average, a couple retiring today will have paid in about $110,000 over their working lifetime. They're going to use in services about $330,000. And that's why more money is going out than is coming in, and Medicare is going to be completely bankrupt in 13 years. So the president actually had a solution. He took $500 billion from our seniors on Medicare, not to save Medicare, but to start a whole new government program. The other thing he did is set up his so-called independent board, but it's the president's board. I believe it is a rationing board that is going to ration care for our seniors. So the president's solution on Medicare is raid Medicare and then ration care. That's not what our seniors want. We as physicians are here to say there are better solutions. We're going to continue to work toward those, and that's why, you know, as a doctor, I go to the Senate floor every week to give a doctor's second opinion about the health care law, because every week something new comes out. And just this week it came out that 3 million people have been put on Medicaid. We're talking about the program for low-income Americans. 3 million people have been put on that who are middle-income Americans. Where's that money coming from? The president raiding Medicare, not to help our seniors on Medicare and to save Medicare, but to put a whole new government program for someone else. And with that, I'd like to introduce Dr. and Congressman John Fleming of Louisiana.
Thank you, Senator. I'm John Fleming, also a physician, family physician, for 36 years from Louisiana. You heard Senator Barrasso express that recipients of Medicare, for every dollar they put in premiums, get back $3 in value. This has been a subsidized program from day one for all payer classes. And because it has been a net cost, we've been shifting cost to other payers. For instance, we've been shifting them to providers, we've been shifting cost to private insurance, and also to taxpayers. We've been going through all of these calisthenics for years through accounting, and even this SGR problem we have, the so-called doctor fix, is as a result of the subsidies that we can no longer afford. And when the Democrats and the President were asked to step up on this, as Senator Barrasso said, the only thing that they did was to cut out $500 billion of Medicare, and the actuary tells us that in 13 short years, the program will be insolvent. I voted for, and many of my colleagues voted for, the Ryan budget, which reforms Medicare. It provides that if you are within 10 years or in Medicare now, that nothing changes for you. The same cannot be said for you if we don't reform it in some way under the Democrat approach. And if you're 55 or less, that what you'll have when you reach those years is a plan very similar to what we have in Congress, where you can choose from many private plans and get premium support based on your income level. So Republicans, I submit to you, have a plan, have a solution. It's been scored by the CBO. On the other hand, the Democrats offer nothing but more cuts. And as a result, we're headed for a disaster if we don't reform Medicare very soon. Thank you, and yeah, I'll let
John, thank you very much. We've been joined by Senator Tom Coburn, long-term member, physician from the great state of Oklahoma. Senator Coburn.
Well, I'm just here kind of as backup and to support, you know, as a primary care physician, the plan that's before us today, we have 150,000 primary care doctor shortage coming. And the response that's out there today on how to handle Medicare costs is called the IPAB board, or it's called the Innovation Committee. Both of those are a disaster for seniors. And the reason they're a disaster is because if we have a shortage of primary care now, and what we're going to have is the IPAB board cutting reimbursements for providers, whether it's primary care or specialists or hospitals, what you're going to see is less access. And the one wonderful thing about Medicare, which is starting to fade away, is that if you're a senior, you can actually get care in this country. It's very different than Medicaid because 40% of the people on Medicaid don't have a primary care doctor, can't get a primary care doctor. So what you're going to see under what's happening with the present plan is access is going to be denied. And that's care denied, and that's care delayed. And so what happens is the Medicare plan as they envision it today is going to change. The second point I would make, and every American should know that, the Medicare that we have today, given our financial situation, no matter whose plan is out there, it's going to be very different in 5 years. And the question ought to be is, do you want to be in control of your health care, or do you want somebody else 5 years from now as this plan changes? Because it will change. We can't borrow enough money in the world to not change Medicare. So it's going to change. So the question is do you as a patient, as a Medicare patient, do you want to be in control of your health care, or do you want a bureaucrat from Washington to be in control of your health care? And that's really the essential question. It's not the details of what the alternatives are. The main detail is, can you control your health care, and can you make the decisions about your health care, or is somebody else from far away going to make it for you? Thank you.
Senator Coburn, thank you. I'll now call on a member of the House Healthcare Provider Caucus, Anne-Marie Burkle from the great state of New York, a practicing registered nurse. Anne-Marie.
Thank you, sir. It's an absolute honor to be here this afternoon, to stand here with my distinguished colleagues, both from the House and the Senate side. I come to this caucus with a slightly different perspective. That is, I'm a registered nurse, and for the last 15 years represented a large teaching hospital as their healthcare attorney. And I want to stand here today and let this message resonate with, especially with our seniors, that the healthcare law that was passed last year changes Medicare. Medicare will never be the same. What the Republicans have done is put forth a plan, a proposal to preserve Medicare. What the Democratic Party has done is demagogue this plan when, in fact, it is their health care law that dramatically changes Medicare for our seniors, and that goes into effect in 2014. I also want to talk to you about a visit I had last week from the members of the hospital that I represented for so many years. And they were so concerned because this health care bill, this health care law, and the changes that it makes to their Medicare reimbursement and to their Medicaid, their disproportionate share reimbursement, will literally bankrupt them in the very near future when this goes into effect. They are very concerned about the well-being of the hospitals. So I stand here before you and I want to, with my colleagues, tell our seniors we have a plan that preserves Medicare. It preserves it for you, for your children, and your grandchildren. That's what this is about. It is preserving Medicare and doing what's right for our senior citizens. Thank you so much.
Congresswoman Burkle, thank you very much. I'll now call on Congressman Paul Gosar, Dr. Gosar, very active in the American Dental Association before being elected to Congress this year from the great state of Arizona. Dr. Gosar.
Thank you very much, and it's my pleasure to be here today. First of all, I've never seen a government-run healthcare system that actually works. And when did we lose the patient's perspective? A patient-centered program where you controlled your healthcare. And that's exactly what we've lost. Medicare has changed, and this administration and the Democratic Congress actually changed it forever. That's where we have to start looking. To shrug this off and to pretend that it's going to be the same is bad for the patients and for the system. When you put this panel together and it delineates what you can and cannot have, that's what's so wrong about your health care. You deserve to make those decisions. That should be between you and your health care provider. And we also have to look at the consequences, what we have in costs. In 1960, when you had a heart attack, you had some glycerin and some bed rest. Today, we're going to crack your chest. We're going to do bypass surgery. There's many things we're going to do, and there has to be some consequences and some costs that we have to factor into it. But anytime federal government has been involved in that, in between you, the doctor, and your patient, something's wrong, and that's where we are. That's why I support the House plan on health care that gets that aspect right, putting the patient, the health care practitioner together, and allowing the patient to decide their health care needs and their future. Thank you.
Paul, thank you very much. We'll now hear from Dr. Bill Cassidy from the great state of Louisiana, one of 3 physicians in the House of Representatives from Louisiana, general internist, gastroenterologist, Representative Bill Cassidy.
I still see and treat patients and teach in a hospital, a public hospital for the uninsured. And if you will, my perspective is very much formed by that. And I have found over the 20 years of caring for those patients that politicians love to overpromise and underfund. One of the reasons I ran was just a frustration with how continuously there are these programs announced, which again, overpromise and underfund. The changes that we saw under Obamacare basically make Medicare a program which is overfunded, overpromised, and underfunded. Now, the way they're going to address the issues of lack of funding is through the Independent Advisory Payment Board, IPAB, Independent Payment Advisory Board. Now, in this, an unelected group of 15 bureaucrats can, from a centrally planned economy perspective, cut reimbursement. Now, we call that rationing. The folks that defend this say, no, a second. In the statute, it specifically says that you cannot ration. I work in this hospital still. I can tell you how the government does it. They don't ration by saying, thou shalt not have this procedure. They ration by putting people at the back of long lines. So they say to the person that has heart disease and needs surgery, you can still have the surgery, but instead of next week, it is next year. For the person with the broken hip, instead of saying you can have it now, they give them a little scooter to go around in until they can have the surgery in 6 to 8 months. This is how it's done in other countries with such global budget systems. Now, there is absolutely rationing in this. It's rationing by queue. By the way, I've also learned in my 23 years in a public hospital where I still teach what does work. When you give the patient the power of the pocketbook, she will make the best decision both for her health and her pocketbook. That is what works. That's the Republican proposal. We continue to oppose Obamacare. There are better solutions. It's part of the Republican reform package. That said, I'll now introduce Dr. Tim Murphy. Dr. Murphy is a clinical psychologist who's previously been on the faculty of a medical school, and he is from Pennsylvania.
Thank you, Doc.
You know, one of the things that all of us as medical professionals have to adhere to is the ethics of making sure we don't practice out of our specialty. I would no more try and deliver a baby than Dr. Gingrich should do to treat depression. I don't do heart surgery, but I do handle a number of other mental illnesses. And so it is that we are all expected to work within our area of expertise, and that's what makes healthcare more efficient. Yet, what the President's proposing, and the healthcare bill has it, a panel of people who have no idea what takes place with individual patients, but they're going to be able to tell doctors, we're not paying, and we say, let's fix this broken system. People talk a lot about waste and abuse, and many times in Medicare, they talk about waste and abuse in terms of people outside trying to game the system. But the system itself is broken. I know a couple months ago when we had Secretary Sebelius before the Energy and Commerce Committee, I asked her, if you were to design Medicare today, would it look anything like it does? And she said, no, and I agree with her. So it is, as the government goes to take on even more healthcare aspects, to have the government try and run healthcare hundreds of miles away from the doctor's office, it's not going to work. Let me give you a few examples of the ineptness of how government runs some aspects of healthcare and how much more expensive it is. Sometimes people need an IV, and sometimes it's called home infusion therapy, which a private insurance company may pay for. Not Medicare. Medicare says you have to go up to the hospital. Even though there's greater risk the patients for travel, greater risk for infection, and higher costs, and even though it costs an extra $6 billion a year, they say you have to go to the hospital. How about if you need some nursing assistance? Well, if you need to go to some place, not a nursing home, but to get some other specialized care, you have to be in acute care hospitals for 3 days. Once they discharge you to home, you can't then go to get that specialized care. You have to go back to the hospital for 3 days, adding tens of thousands of dollars to a bill needlessly. How about coordinating the care of the patient? When you look at hypertension, heart disease, cholesterol, and diabetes, the amount that they cost altogether in Medicare is in the hundreds of billions. And a recent report out of Johns Hopkins says that if you allow programs like Medicare Advantage to work instead of zeroing out as the Obamacare plan did, you can save $10 billion by getting to these folks and coordinating their care early. How about prescription misuse? You know, 50 to 75% of prescriptions are not taken appropriately by the patient. What does that mean? That means they end up going back to primary care doctors, back to emergency rooms, or rehospitalizations. Cost the system, $258 billion a year. And oh, by the way, Medicare will not pay for a nurse in that doctor's office to check up and see, did you get your prescription? Are you taking it right? Are you following that? Do you have any side effects? What other medications are you taking this may interfere with? My point is this: we fix the system. You allow people in the medical professions to work to make the patient get better. But when your only tool is a hammer, everything looks like a nail. And right now, the only tool that we hear the administration wants to do with some of these things is have this independent panel from hundreds or thousands of miles away deciding that they're not going to pay for it, or they're going to continue to pay too little for doctors to be able to treat patients. That's not good health care. That's not even good fiscal management. We want to see this system fixed and not just financed. With that, I'll yield. I'm not sure who's speaking next here.
Yeah,
Dr.
thank you.
Thank you.
Thank you, Dr. Murphy. And next, we'll hear from Dr. Scott Desjardins from the great state of Tennessee. Dr. Desjardins.
Thank you. I'm proud to stand today with fellow members of our GOP Healthcare Caucus. I can say that getting to know all these members, not a single one of them went to medical school, nursing school, or dental school with the intention of ever ending up here in Congress. They went there because they care about people, and they came here because they care about people, they care about this country, they care about our children and our grandchildren. And we can clearly see that the plan laid before us is a path towards destroying the greatest healthcare system the world's ever known. And we will take it upon ourselves, along with our colleagues, to set the record straight, that we are setting forth a course to preserve and protect Medicare. There is a plan in place now by the opposite side of the aisle that will end Medicare as we know it, will end the best healthcare system as we know it. We are committed to preserving the physician-patient relationship. We are committed to preserving Medicare, and I look forward to working with my colleagues to do just that. Thank you.
Scott, thank you. I don't know if he told you, but Scott is a family practitioner. I'll now call on one of my colleagues from Georgia, another family practitioner, who actually does a house call practice, believe it or not. So he knows of what he speaks in regard to Medicare patients, the Honorable Paul Brown from the great state of Georgia.
Thank you, Dr. Gingrey. We have two options here: reform Medicare or let it go broke. Then nobody has access to it. So far, President Obama's plan has been the most dangerous one of all. His plan is to do absolutely nothing. Instead, under Obamacare, he took away $500 billion from Medicare and then handed off the fate of the program to a bunch of pin pushers who sit on iPad. We cannot stand by and watch helplessly as this liberal administration destroys our seniors' health care by letting it go broke. If they don't know how to save the program, I, for one, have plenty of suggestions of where they can start. Thank you.
Dr. Brown, thank you very much. And next, I'm proud to call on my OBGYN colleague from the great state of Tennessee, Dr. Phil Rowe. I'm sorry, I think Dr. Rowe had to vote. We'll now hear from Dr. Larry Bouchon, cardiothoracic surgeon from the state of Indiana.
Well, it's great to be here with my colleagues in the medical profession here in Congress. As Dr. Desjardins said, I didn't imagine myself being in the Congress when I went to medical school, but really over the last 5 years or so, with the direction healthcare is going in this country, I felt that we needed more medical professionals in the Congress, be in the room, and have a voice. And so that's why I ran for Congress. I think it's important to point out that if we do nothing with Medicare, 2024 Medicare is insolvent. And that's under current law. That's with Obamacare, with the Affordable Care Act in place. The inaction by the administration on the future of Medicare is the worst thing that we can do. Medicare will be changing regardless of what we do, and it has already changed under the Affordable Care Act. And denying that won't change the fact that seniors in this country will not have access to physicians in this country in short order. Already 1 in 3 physicians in this country is limiting the number of Medicare patients that they see, and 1 in 8 does not see Medicare patients at all, and that's according to the American Medical Association's data. That will continue to accelerate. In fact, under the Affordable Care Act, the reimbursement to providers for Medicare program, if nothing's done, drops below Medicaid reimbursement by about 2020. So we know the access issues that Medicaid patients have. Now we're transferring that over to our seniors if we don't do anything. The Republican plan saves Medicare for our seniors, gets us back on a fiscal course that we can sustain, and continues the doctor-patient relationship, which for us physicians is the key. We don't want bureaucrats in Washington, D.C. telling you how to get your health care. We want your doctor to do that along with you and your family. So I'm proud to be here today, and we have a great group of medical professionals in Congress, and we're going to continue to work on behalf of our patients. Thank you.
Dr. Bouchon, thank you. Indeed, we do have a great group of healthcare providers in the Congress, both in the House and the Senate. In fact, on the House side, 21. And 3 of those new members of the Healthcare Doctors Caucus in the House are registered nurses. Now I'd like to turn the podium over to the great state of Tennessee's representative and registered nurse, Diane Black.
Thank you, Dr. Gingrey, and it is a pleasure to be here today. I want to thank the Doctors Caucus for including other healthcare professionals such as myself. I can tell you over the last 40 years of my being in nursing that there is nothing more important than the doctor-patient relationship and the caregivers that touch the patient. We can have all the new technology, all the new drugs that we can possibly research and bring to the market, but there is nothing more important than a doctor-patient relationship. And the bill, the Patient Affordability Act, by putting in place a board that is of appointed people that are going to make decisions about what kind of care is going to be given to the patients, will destroy the very core of what has made our medical system the best in the world. The plan that has been passed in the House, the GOP plan, puts in place some choice, and we give people choice. We also have competition that will allow the program to be sustainable. The dirty little secret, as I tell people in my district when they say, well, don't touch my Medicare, is what they don't know is their Medicare has already been touched. And their Medicare is about to change without them even knowing it. They are going to have $500 billion worth of funds taken out of that pot of money, and then also put into place a board that is going to be making arbitrary decisions for them. So they have already had a change in their Medicare, and what we are planning and what we have brought forth is a plan that will be sustainable for the future. And I am very proud to stand here today with my other colleagues at this press conference to let to be known the truth of the matter. Thank you.
Thank you, Representative Black. Batting cleanup for us today is General Surgeon from the great state of Michigan, Dr. Dan Benishak.
Good afternoon. Prior to coming to Congress, I've been taking care of patients in Michigan as a physician and surgeon for 30 years. And a lot of those patients are Medicare patients. And I want to see doctors be able to take care of Medicare patients forever. The way things are going now, that's not going to happen. I came to say to the president and to my Democrat colleagues, shame on you for scaring our seniors by giving these false statements about our plan. Our plan doesn't change benefits for anybody at or near retirement, and it protects our children and grandchildren so they'll have a system to depend on. The fact is, Obamacare has taken this $500 billion away from Medicare to fund Obamacare, and then puts these unelected Washington bureaucrats as the arbitrator of what you can do, putting themselves between doctors like myself and my colleagues and our patients. That's not what we need here. That's really a smokescreen to distract people from the fact that Obamacare really solves the problem with bankruptcy and rationing. Thanks. Have a great afternoon.
Dr. Benishak, thank you. I said he was batting cleanup. Now, coming to the podium to deliver the walk-off home run is my colleague from Georgia and chairman of the Republican Policy Committee, orthopedic surgeon, Dr. Tom Price.
Thanks, Phil. Thanks so much. That's only because Georgia's home of Ty Cobb, so we know how to hit home runs in Georgia. I'm privileged to stand with my medical colleagues here to talk about, very briefly, the Medicare program and what the other side, what President Obama and the Democrats have done to it. We had the Medicare trustees report before our committee, Ways and Means Committee, this morning, and the important takeaway from that was getting the individuals who were representing the Medicare trustees to admit that Medicare, as we know it, has already been destroyed. It's already been changed by the Democrats. As my colleagues I know have said, by taking $500 billion out of the program, raising $500 billion in taxes, and then putting in place an unelected board of bureaucrats to ration medical care. That's not Medicare as we know it. Our proposal, as you all well know, as the American people are learning, is to save Medicare for the current retirees, current seniors, and for future generations. We believe that's the positive thing to do. We believe that's what our patients desired when we were in medical practice, and we believe that it's the right thing to do for all constituents across this land. I'm honored to stand with my colleagues and put forward that positive, patient-centered solution for Medicare. Thank you.
Tom, thank you very much. You've heard from about 14 members of the House and Senate, healthcare providers, regarding this issue. The Democrats like to picture us as pushing grandmother over the cliff or throwing somebody under the bus. In either one of those scenarios, at least the senior has a chance to survive. But under this iPad that we described that the Democrats put in Obamacare, where a bunch of bureaucrats decide whether or not you get care, such as continuing on dialysis or cancer chemotherapy. I'll guarantee you when you withdraw that, the patient is going to die. So it's rationing. And as Dr. Price said, they have already almost destroyed Medicare as we know it. We are going to stop that. I asked my colleague, co-chairman of the GOP House Doctors Caucus to join me at the podium, and we have time maybe for just a couple of questions before I have to at least go vote.
We have to go vote, yeah. Anything?
Yes, sir.
Well, political damage comes when people distort the issue, and it was totally misrepresented. The issue is that members of Congress, federal employees, have choice in their plans. Senior citizens have choice in their Medicare plan. They can choose their Medicare Part D, they can choose their Medicare supplemental, and for anybody to pretend otherwise and misrepresent it, it's being disingenuous and trying to garner votes on that. Look, we want to have an honest discussion with the White House, we want to have an honest discussion with Democrats. But creating these falsehoods and saying that's what's going to happen politically, they're lies, and all of us are going to be out there also talking to senior citizens and telling them the truth. Yes, there are those who say if you tell a lie often enough, eventually people will believe it. We also trust the senior citizens are smart enough not to fall for it and just not look behind the curtain at the Wizard of Oz here. We know that there's serious problems with Medicare. It is out of money. It is mismanaged. Even if there's good people there, that's what we have to fix, and we want to see that fixed by seniors being part of helping to fix it.
Absolutely. Yes, ma'am. We are holding our breath so long that we might look like blue dogs waiting on the president to get back in touch with us in regard to that. When we had the opportunity, the Republican conference, to visit the president at his home base, actually the People's House, and he said to us when we stopped him on the way out and literally said, "Mr. President, we members of the House Republican Doctors Caucus would love to have the opportunity to sit down with you and discuss some of these issues to help do this in a bipartisan way to truly, as Dr. Murphy just said, save Medicare, not just for current seniors and those 55 and older, but for the future generations." And he said, absolutely, we'll make it happen. He turned to one of his trusty aides and said, let's schedule it. We're still waiting. Hope springs eternal.
Right, we've got a vote on the floor. We've got a 0 time.
Real quick, and Tim, I'll be right behind you. Yes, sir.
Yeah, Democrats in the past week have brought back a couple of issues that affect the pharmaceutical industry in the Medicare talks, talking about drug rebates for individuals, dual eligibles in Part D, also negotiating prescription drug prices. Do you think that any of these proposals, long favored by the Democrats, have any place in the debt limit talks?
Well, you know, there are some places, in my opinion, speaking as an individual member, as a physician member, in regard to some of these things that you brought up. I can't touch on all of them, but in regard to Medicaid, the elimination in Obamacare of the maintenance of effort provision, which puts handcuffs on the 50 governors. It's not just Republican governors, but I think most of the Democratic governors feel like that is going to cause them to have deficits that they can't sustain, and they're under a constitutional obligation within their states to balance their budget. So there are a lot of things that I think need to be and probably are being discussed among that small group led by Vice President Joseph Biden, and I hope that we're going to get some meaningful results out of that. The clock is obviously ticking. But you mentioned Medicare Part D, or maybe you mentioned the Democrats' desire to set prescription prices, have the government, in fact, do that. They wanted to do that when we passed Medicare modernization and the Prescription Drug Act back in 2003, my first year in the 108th Congress, and they wanted to actually set the premiums for Part D at something like $44 a month. We let the market prevail, and they came in at something like $26 a month. We stand by that in regard to letting the market prevail. Thank you all very much for your attendance. I really appreciate your patience.